we think back to why is healthcare powered by insurance in the first place, right? And it's something I mentioned to you, which I think was another thing that I caught my mind of health insurance is like health insurance is one of the only places where people want to utilize insurance sometimes, right? Like no one wants to get in a car crash, right? But with health insurance, you want to use your health insurance. So if we are able to get past what you've called out several times, which is correct, I would see that we're on like a local maxima, right? Like we're like, why the reason it's hard to get off the local maxima is because it's working. It's working for a certain set of folks in the US, not everyone, but a certain set of folks. It's working for certain health systems, certainly for certain health insurers. It's a profitable way to deliver healthcare. And some of us who are very lucky, we get pretty good healthcare at the end of the day, right? It's time we need to move to the next global maxima, which is hard, right? Which is why Clover is one of the few folks trying to do this, is because the local maxima is enticing. It's another way to say innovator's dilemma, right? Is to be on there. Where we need to go into the future is pretty obvious, is we need more physicians, providers delivering care. They need to be spending more of their time delivering that care and not doing documentation and trying to do billing and all these kinds of things. At the same time, we need to also figure out how we can allocate capital to provide for these better experiences for our patients, to provide for better experiences for doctors. And I do think that the US, I know we're always sort of like, it's fun in the US to malign the US healthcare system, right? But I do think that we have a proven model of innovation where other countries, it's not perfect in other countries either. And they're sort of bogged down by their socialized systems or entitlement systems. And finding that right hybrid for the future is going to always involve physicians, data-driven physicians who have all the information at their fingertips and who are able to just sort of give better care with sort of less time being dedicated to overhead. All of this inefficiency is a place where no matter which model of care you like, whether it be like the European social systems or the US system, private insurance, government-funded insurance, single payer, right? Like all of these are means to play with going to the same place. What's missing is just focusing on the care being delivered by the doctor and bringing together that payer-provider relationship even closer. It's too often adversarial. By bringing it closer together, using technology to bring it together, we end up in a much, much better place, I think, under all paths in 3, 5, 10 years' time. I'm Andrew Toy from Clover Health, and this is the future of insurance.